First X-ray which skeletal vision series would be our ankle joint AP view. So a total of 3 bones are basically involved in the formation of the ankle joint. So one we have is the distal end of tibia, then we have is your distal end of the fibula, and then we have the talus. There's a special area which is the overlap area between the distal ends of tibia and fibula, which is seen on the AP view of the ankle joint. We call it as the tibiofibular overlap area. There are total of 3 malleoli in the region of the ankle joint. Okay. We have the medial malleolus, which is seen at the distal end of the tibia. Then we have the lateral malleolus, which is seen at the distal end of the fibula. And there's a third malleolus, which is not very well visualized on the AP view. It's better visualized on the lateral view. It is the posterior malleolus. It's also present on the distal end of the tibia. There are a total of 6 articular surfaces. The distal tibial articular surface is given a special name. We call it as the tibial plafond. Okay, it articulates basically with the dome of the talus. Then we have the medial surface of the dome of talus, and then we have the lateral surface of the dome of the talus. They basically articulate with the inner surfaces of the medial malleolus and lateral malleolus, respectively. The ankle joint space is basically divided into a total of 3 spaces. We have superior joint space, medial joint space, and then we have the lateral joint space. Out of this, the superior and medial are visible on the AP view, while for the lateral joint space, we do a specialized view. We call it as the mortise view. Okay, so this is your superior joint space, okay, which is between the articular surface of the distal tibia and the dome of talus. And then we have the medial joint space, which is basically between the medial surface of the dome of talus and the inner surface of the medial malleolus on the distal end of tibia.